Pain treatment procedures for trigger point injections capped in codes 20552, 20553, have a 13% denial rate according to the latest Medicare Part B claims data, and received a 98% denial rate during a recent medical review by National Government Services. Documentation and coding for trigger point injections is mediated by strict local coverage determinations, LCD, and private payer policies. These factors can combine to make receiving proper reimbursement for trigger point injections a painful undertaking. Begin with the coding basics. Review the codes, full descriptors. They are full of detail that can assist with coding. 20,552, injections, single or multiple trigger points, 1 or 2 muscles. 20,553, injections, single or multiple trigger points, 3 or more muscles. The descriptors tell staff that providers must document the number of treated muscles. Coders must look for the number of muscles treated, not the number of trigger points addressed, when they report the service. For example, if a provider addressed 3 trigger points in 2 muscles, the coder would report Captain Code 20552. If a provider treated 3 trigger points in 3 muscles, the coder would report 20,553. If a provider treated 4 trigger points in 4 muscles, the coder would report 20,553. Physician coders should not report both codes for the same patient on the same date of service or report multiple units of service for either code. Injection code 20552 is bundled into 20,553 and coders should not use a modifier to break the edit pair. In addition, Medicare assigned a medically unlikely edit (MUE) of 1 to both codes and sealed it with the MUE adjudication indicator (MI) of 2, so coders cannot appeal unit of service denials. And MI of 1 indicates that the edit is a claim line MUE. And MI of 2 or 3 indicates that the edit is a dose MUE, date of service MUE, according to Chapter 1 of the Medicare NCCI Policy Manual. The manual further explains that if a HCPCS or CPT code is a claim line edit MUE, coders may use appropriate captain modifiers to report the same HCPCS CPT code on separate lines of a claim. Doing so will allow that HCPCS or CPT code to be separately adjudicated against the MUE value for that HCPCS CPT code. MUEs for HCPCS codes with an MAI of 2 are absolute date of service edits. These are per-day edits based on policy, and cannot be overridden or bypassed by appending a modifier. Use definitions, documentation requirements. Trigger points are tiny contraction knots that develop in a muscle when it is injured or overworked. The physician identifies the trigger points by palpating the muscle. National Government Services LCD for Pain Management explains that trigger points produce a referred pain pattern characteristic for that individual muscle. Production of a referred pain pattern differentiates myofascial pain syndrome from tender points and fibromyalgia. In other words, diagnosing a trigger point includes a physical exam, palpation of the muscle, and determination of the referred pain pattern. Coders should see that information in the treating provider's note. Several Medicare administrative contractors (MAC) and private payers have specific documentation requirements that providers will need to follow. However, a review of LCDs and private payer policies revealed several common elements. Failure of conservative therapy, the muscle group or groups involved, the number of trigger points injected, the reason the treating provider used trigger point injections. What's the frequency? Pay close attention to frequency limits for this procedure. MACs and private payers typically expect additional documentation when a patient receives more than 4 treatments in a year. However, Noridian states that the injections would not usually be performed more often than 3 sessions in a 3-month period. Coders can remind providers that when they create detailed documentation at the start of treatment, it may be easier to support extra treatments for patients who need it. In addition, coders may encounter a hard frequency limit on the service. For example, Palmetto GBA, a specialty MAC based in South Carolina, will not cover more than 4 trigger point injections in a year, and Anthem, a Blue Cross Blue Shield insurance provider, states that trigger point injections in the diagnostic or stabilization phase should be limited to 4 times a year. Example to explain the documentation requirements for a trigger point injection. History. The patient is a very pleasant 71-year-old male who is referred to the practice by his primary care provider for the evaluation and treatment of neck pain. Upon evaluation, the patient had pain over the right mastoid region and was treated with a trigger point injection. He states the pain did improve somewhat but has returned, although he does not have the pain today. He states that most of the pain has switched over to the left side. He has pain over his left mastoid area and his left interscapular area. The pain, he states, is worse at night. Physical examination. Upon evaluation, the patient does have a sensitive area over the left mastoid and a palpable trigger point with a positive jump sign over the left interscapular region. I elected to perform trigger point injections for him today. I discussed the risks and benefits of the injections with the patient. Procedure. The areas were prepped. A 1.5-inch 25-gauge needle was used to perform trigger points in both areas. A total of 7.5 cc of 0.5% Marcaine and 20 mg of Depot-Medrol were injected into each trigger point. The patient experienced good post-procedure pain relief. I will see him back on an as-needed basis.